My name is Lederhaus, and I'm a physical therapist, and happy today to talk about a common issue we see in runners is plantar fasciitis. I've been a physical therapist since 2009, and what I've noticed over time are patterns we see in people. And just like any other injury, plantar fascia has its pattern that we can see and hopefully capture to identify it and how to treat it. So we'll talk about the anatomy, the symptoms and causes, and the treatment. So here's a common thing I see. I have a runner come in and they're like, hey, I began running and I recently increased my training program. Everything has been great, but recently I noticed some pain on the bottom of my foot when I wake up in the morning and start walking. The pain is pretty sharp, but gets better as I continue walking. Help me. How do I fix it? I see this all the time. So first, so you don't feel alone, 17% of running-related injuries are classified for plantar fasciitis. The average healing time is about 6 months. And I think I've seen a lot faster than that, but I want to give some perspective. The plantar fascia, which we'll show in a moment, the anatomy of it, but it's a ligament. It's not a muscle. So as such, it's not a lot of blood flow to the area. And if it's not a lot of blood flow, it takes a lot longer to heal. So that's why these injuries could be a little bit stubborn in terms of healing time. It's a ligament that we're treating, not a tendon or a muscle. And females tend to get this more than males, but luckily most of it can be treated very conservatively. So if you have it, don't give up hope. The probability of you recovering from this is very high. Some risk factors that contribute to developing plantar fasciitis, at least that I've seen clinically and what the evidence says, is first increased pronation. What that means is your arch kind of collapses in. Now, some people have inherently overly pronated feet and they're fine. So I want to make the point that just because you have increased pronation, for example, doesn't necessarily mean you will get plantar fasciitis. It is a contributing factor, but some people do very well with decreased arches or overpronation. We see a lot of workers that have increased standing time, like say at a supermarket, just more pressure on the feet over time. Also restrictions in dorsiflexion. I put the picture on your right, what dorsiflexion is and plantar flexion. If you have decreased dorsiflexion or ankle mobility, it tends to put more pressure on the plantar fascia due to the compensation. Also, people that have higher weight or obese, of course, that puts more pressure through your feet and more pressure through the system. And I asterisk the last point of overload. Specifically for runners, we see, again, people going too hard, too soon, too fast. All your tissues respond to load, and they can heal if you give enough rest days. To note, if you're beginning a training program, usually you don't see the errors in your training until a month after. So no, it's kind of delayed effect, but training error is a huge thing I see with this type of injury. So looking at the anatomy, the plantar fascia, like I said, is a ligament. So there's not a lot of blood to that area. It's a thick fibrous band. This is interesting to note too. We say itis, mean it's inflammation. So plantar fasciitis. It's kind of a misnomer and not used properly. Itis is usually increased redness, swelling, much like higher pain. This condition tends to be more degenerative over time, meaning it's more chronic. There's absence of inflammatory cells, so it's more of a chronic degeneration. And what's common about this, because it's on the bottom of the feet, it's of course worse with first steps in the morning. That's one of the hallmark signs of plantar fasciitis. And what people tend to notice, start walking, and the pain tends to decrease as they walk. And the reason for that is when you're sleeping, your feet tend to plantar flex, and that slackens the plantar fascia. So in the morning, when you put weight through it, it quickly stretches it out. And if you have an irritable segment in the tissue, it tends to just not like that. So it's being overstretched. And this is a side view of the foot with the plantar fascia you can see pointed to down below. What's the purpose of it? It helps support the arch. It creates passive stability to the foot. So in the next picture, you can see when the toe is raised on the right-hand side, it creates increased arch height. So the mechanics of it again, absorbs shock and also supports the arch. So how do we diagnose this? 3 things I use are the first step in the morning is primary thing. There's not too many different tissues on the bottom of the foot that could be problematic, at least common patterns that we see. So if you get up aching in the morning, that's probably plantar fasciitis. Touching the tissue underneath the foot tends to be very tender, and you might notice more clumpiness in that area. So it should be kind of smooth as you palpate it. But what I notice with a lot of people suffering through plantar fascia issues, it's kind of a thickened type tissue in that area and sensitive. And this third one called the windlass mechanism is essentially just stretching the first toe up or even the toes up. And that creates more of a passive stretch on the plantar fascia. And the idea is, hey, if it increases pain, and may be indicative of plantar fascia. And as I said, kind of briefly in the beginning, the symptoms are usually a sharp stinging pain in the morning and gets better with walking. The pain may initially subside as you run, but over time, if you don't treat it well, the pain actually might get worse and worse in that you feel it more often or earlier in the run, or it becomes just ever more present. Pain is telling you a story. Pain usually says the tissue is not strong enough, either compression wise or tension wise. And so it's trying to get your attention. So you can ignore it, but if you ignore it, it may not get better. In fact, it'll probably get worse. So please pay attention to your symptoms for guidance. So part of the fun part is, okay, how do we treat this condition? I've kind of revamped how I looked at tissues through the years. My perception on a lot of treatment for plantar fascia is that a lot of people just stretch it, like the ankle, and they self-massage that area. That is actually fine, and I do those treatments. But what I think is missing for a lot of people is increasing the load capacity to the tissue. Remember what we said, that the plantar fascia is weakened? It might have been overstrained, and it didn't quite heal the way you want it. So it's load intolerant. It can't accept the loads you place upon it. So it's a load issue. And how do we treat load issues? Is we have to increase its load capacity. And how do we do that? We strengthen it. The picture on the right is simply a heel raise. But the caveat is, you see the toes are bent up or supported on, like, you can roll towel or whatever you may have to increase the tension on the plantar fascia. So I have every plantar fascia patient do some soft tissue, stretching, but most importantly is increase the strain on the plantar fascia for it to adapt. I have them work out into slight discomfort where they feel tension on the plantar fascia, usually 3 to 4 days a week. Now, as I'm saying this, there are other things that might contribute, like you can say hip strength, calf strength. There are other things that we can go over, but this is one of the things that I think is lacking in most treatments for plantar fasciitis. And so usually people think it could be their shoe. That could be one possibility. And that's usually one of the last things to change. So it could help to put more cushion on there or more of an arch support. But I say before you change shoes, let's just strengthen the tissue to see where it goes, so you don't have to spend money and waste time that way. And if I'm indeed wrong, if it doesn't change, then we can try the shoes. But usually people look for alternative sources other than the fact that they can just simply strengthen that tissue. So I want to stress that. Please load that tissue. And I usually do it, this is on the ground, I usually do it on a step. And again, stretching and self-massage does help. And I do that with my client and tell them how to do that, but isn't usually the solution most of the time. It's you need the loading. And again, the load into pain is okay. Depending on the condition, if it's very high inflammatory itis, you don't want to load into pain. And I did, again, have a talk about should I run with pain or not in one of our previous talks that you can kind of reference to. But for this more chronic kind of condition or stubborn condition, loading into pain is okay. Usually I say about less than 3 out of 10, and I don't want a lot of pain the next day or the next morning. So you're stimulating that tissue just enough, but you're not underloading it where it's not changing the tissue loading capacity. And if it gets easier, you add weight. So running form could also be a contributing factor for developing plantar fascia. So I have my clients, if they have plantar fascia issues, along with the training, suggest maybe lighter steps or more of a midfoot strike, so it's less pressure going through the system. And again, depending on the client, I might do a run walk program, perhaps running more on an incline or softer surface would be more forgiving. But also you can't negate how you're eating, how you're sleeping, your training program. Usually, again, for the running community, it's the training program that I find most of the culprit. Again, just going too hard, too fast, that kind of scenario where we have to kind of pump the brakes and recalibrate. And so on the market, as with most pain, is assistive devices. You don't have to buy fancy stuff. People like rolling their foot, as you can see the red little ball there. You can use a lacrosse ball, a tennis ball when you're sitting there at the computer or at work. I just simply self-massage that area if I were to have it. So that tends to help people break up some of that fibrotic tissue that might be in the plantar fascia. There's a splint on the right. Those are meant for nighttime. And the idea behind that is you keep it stretched out. When you get up in the morning, it's not painful. And it's an adjunct. It won't treat it, but it does seem to help some clients in that manner. If you reference our site, we show you how to tape the plantar fascia. That can also help unload the tissue as well. And icing, I tend to like ice. You can make an argument for heat or ice at this point if it's more chronic, but it tends to calm down the system after you beat it up a bit. For the most part, though, most people don't need assistive devices. It's mostly loading, soft tissue work, stretching, and respect the healing process as you get back into running.
So we have our website, and there's various ways to progress through it. But if you already know you have a foot injury, we can kind of go to the quick links index. Some of what Eric's touched on is under the causes, and we design a lot for education and to help you understand in depth all the possibilities. And so there's a lot more here than even Eric reviewed in this workshop that he would apply to his physical therapy as well. But ways to test yourself, ways to assess vulnerabilities, strengths, etc., and just understand, does this sound like what you're going through? If it continues to resonate, you're like, I think I have plantar fasciitis. We then have a rehabilitation plan. This is behind a member wall, but there's a way to explore this for 1 week for free without any commitment. And so you can start looking at the taping that Eric was referencing, different types of rolling, and other recommendations with rehabilitation, and then proceed to the bulk of the recovery process, which is what he was talking about with regards to loading and conditioning. This is just some introductory information about how to sort of set yourself up right for conditioning, which kind of goes hand in hand with rehab. And then we have 4 phases with detailed instructions of how long, how much, and just very user-friendly guidance with videos and written explanations of different ways to start strengthening those tissues and, possibly other related tissue that could be influencing the plantar fasciitis, and not even just the foot, but calves, hips, etc. And there, again, are 4 phases, so you can just work through those in the way that it's instructing based on your readiness. So I wanted to just highlight that. Again, you can start a free trial to explore those more in depth on your own time, and that's under the member link.
Because they're very much interlinked. The plantar fascia and the Achilles tendon have fascia that connects to them. So something you're doing right now on the right side, and it could be a combination of factors, but something's not quite sitting right there. So it could be making an argument with lack of dorsiflexion on that right side. It could be a hip strength issue on the right. I'm not sure if you stand, if your right leg kind of hangs out a little bit more than the left. My left does, actually. I guess some questions to you is, do you have a strengthening program? Do you load your Achilles tendon? Perhaps the calf isn't strong enough, so it puts more pressure on the plantar fascia. So those are great questions. It could be running form too. And again, I don't have the answer to that because I don't know your case specifically. So there's a lot of hypotheses as to why. That I'll be happy to talk with you 15, 20 minutes to talk a little bit further and get a little more insight and hopefully guide you a little more specifically. I do get those injuries common enough where we see the paired together. It's a common thing. I refer those to my clients at a kind of like changing your shoes. I don't like to give inserts right away. One, because it changes the structure of your foot right away. And so you get maybe other different compensation or issues that put more stress and strain. So I wean my clients on arch supports. And if they really need it, some really enjoy the help. But I first try to strengthen it, tape the arch for support, strengthen it. And if they need that, that's fine too. But a lot of people go to that right away. And again, it doesn't strengthen the plantar fascia. It helps unload it a bit, but it won't get rid of the problem. And so you might have a more vulnerable plantar fascia over time.